Hi guys, good evening. It's Dr. Jenny Yusuf, physical therapist and doctor of physical therapy. Another, thanks God, it's Thursday. And for tonight, if you are here in United States of America, first of all, good evening. In United Arab of Emirates, salam alaikum guys. And also in Philippines, mabuhay. It's another thanks God, it's Thursday. Every Thursday, we highlight innovators, physical therapists, clinicians, academicians, professors, anybody who's doing well and giving lots of knowledge and also highlights in their field. And tonight we would like to know more about different setting as a physical therapist and also want to know more about different knowledge in how to be a physical therapist here and different reviews. How can we access some of the different resources with the knowledge, of course, of one of our physical therapists, doctor of physical therapists, and also specialize in physical therapy in manual physical therapy. And we will going to know more about that with Gabrielle Cordero live in Dallas, Texas. Welcome, Gabriel.
Thank
Gabriel,
you.
can you correct me the last credential I just said? The
It's
SM.
SMTC, so it's under
Yes.
Institute of Athlete Regeneration with Dr. Toko Win. So it's
Mhm.
more of a hands-on like manual therapist certification where we just go over like a brief overview of like the basic stuff that would carry over to your clinicals.
Yes. So yeah, it's more on the orthopedic setting. So thank you so much. Welcome, Gabriel. Welcome for the Balance and Fall Support Group and Fishigen PT. So where are you right now? You are currently in Dallas, Texas,
Yes, I
and one
am.
of the physical therapists in acute care setting in University of Texas in Southwestern Hospital, right?
Yeah.
So congratulations. So tell us more your transition. Are you exactly already in the acute care? I believe you been in orthopedic first. And how many years are you now practicing in America? Thank you.
Okay. So I got my license back in 2019. So I graduated in the Philippines 2018, moved here to the States, took the test and fortunately passed. I started my career off in New York. So I work with professional physical therapy, which is an outpatient orthopedic sports. So your typical we handle different sports injuries from ACL, knee replacements, hip, shoulder, stuff like that, ranging from, amateur athletes to like geriatric population, and then just a mix of general pop. And then I stayed there for about a, a year and a half. And then I made a transition to Texas to be closer to my family. So again, I work with Vista Rehab in sports medicine, which is again another sports clinic, same population. And then I got a few certifications with, as I mentioned earlier, Institute for Athlete Regeneration with sports manual therapy and dry needling alongside blood flow restriction training with smart tools. But then I decided to sort of switch my career up a little bit and venture out into the world of acute care. So right now I work with UT Southwestern Medical Center, and I'm just starting off. So I could just briefly, I could gonna be discussing, what I'm going through, the orientation, and sort of like different patient population I handle.
Yeah, sure. So that's really interesting. You have lots of skills in an outpatient setting, dry needling, and that's really a wonderful manual therapy, of course, in outpatient. So what triggers you to go in an acute care as a new venture?
That's actually a very good question. I get that a lot. I think it's just sort of exploring different ventures out a little bit. I've been seeing a lot of orthopedic cases, so I wanted to see what else is there for PT. So one, so while I'm still young, I obviously want to sort of find my niche, and then sort of find my calling and see which area my skill sets are going to fit best for long term, and where I'll see like a lot of potential growth in my career. And I think right now transition here in the hospital-based setting is where I think is a good stepping stone for that. So, but for now, I just focus on now. just keep growing, keep learning from all these veteran PTs, where we have these PTs that have been working in the same hospital for like 10, 15 years. One's been working there for 28 years, which is as long as I've been alive, which is absolutely interesting when I see her out in the hallway. So I'm just picking their brains, learning as I go. So, and then I'll go from there.
Yes, yes. And what are the different cases? Majority in acute care, we have lots of neuro
Mhm.
cases as well, right?
Yep.
Specialty.
Um,
So what's your majority of cases right now?
So I think in UT, I can't really speak for other hospitals how they function. Well, in our hospital, where when you first start off, they sort of orient you in different floors. All right. So let's say my first rotation was actually in oncology, where I worked with oncology and then bone marrow transplant patients. So they pair me up with someone that's actually board certified in oncology physical therapy. So I stick with her for about a month. I asked her question after question. I sort of shadow her, ask her about different lines, different treatments, and then what do I look for lab values? So because definitely that is something I need to brush up on, different values. And I came from smaller clinics, so I was only working with two or three people. But now I'm working in more of an interdisciplinary group. So having that confidence to sort of speak with like nurses, doctors, and other professionals, how I could convey, hey, this patient is good for this, or these are my recommendations. So just sort of stuff like that, um, to get the ball rolling and sort of jumpstart my career here. Um, and then after you sort of work alongside that experienced PT, you sort of go off on your own for about a month, couple months or so, and then they transition you to the next floor. So for me, my next floor was actually in the cardiovascular unit, where we handle, heart and lung transplant patients who just got their LVAD or different valve replacements. So I was mentored with those CCS, I believe, those cardiovascular specialized PT. So she mentors me different lines, which I thought was probably one of the hardest ones because there's different lines, a little bit more critical because they just got a new heart, new lung, stuff like that.
Yes.
Um, and then again, stayed there for about a couple months. So right now, I think I'm in the more geriatric population now, where
Okay.
we have more so like hip fractures, hip replacements, but very, very acute early on. So it's more general medical surgical kind of stuff. So,
Yeah.
and I'll rotate in more units, but for now, these are the ones I've experienced.
Wow, and it's only recent months, and that's really amazing and very interesting cases, oncology and cardiovascular. It's
Mhm.
if I will be with you, and especially I'm really new, and you've been in the most complicated case right away. I'm afraid of different lines. When you're in the ICU, you don't know how to move.
Um,
You're so careful on different lines there, and then how you can access and lots of attachments as well.
And that's
So
true.
I
And
remember. Mm-hmm,
definitely, I attribute my growth to all these mentors. If it wasn't for them, obviously, I would
mm-hmm.
stay confused. So it's good to have that strong mentorship, which
Yes,
obviously accelerates your learning so much more. You become more confident, and you've seen this case before with them. Now you know how to handle it, and then you know the
that's
rest.
true. And that's true because when you're very comfortable now and with that lots of experiences in orthopedic, sometimes you're looking forward, what else do I want to learn more? And then
Mhm.
just changing a different venture, a different line, and you will see, oh my God, there's a lot more to learn, you
Mhm.
know? And then especially the LVAD, I'm in home health, and then we have a case that LVAD, and then really like, oh, we don't need to do the blood pressure. Oh, no need for heart rate and then things like
Yeah,
that. And we're automatically doing that. And then it's really like, really, really nice to learn more something that you've been like doing it automatically before. Now you really learn. You're now like a sponge. Keep
yeah,
observing, right? So
true. I
what
mean,
is the most, during your few months in acute care, what is the most interesting case that you remember?
I guess the most interesting case I've had is definitely those new heart transplants and lung
Oh,
transplants.
yes.
Usually when I get them, they've already been here for about a couple days or so. So they've already been
Mhm.
oriented. Hey, these are our expectations. These are our goals for next upcoming week or so, depending how long you're here. But when you get them fresh, you're sort of doing a lot of education, such as thermal precautions, um, just looking out for vitals, and then sort of building their endurance or building their strength. And there's going to be a lot of patient education early on because they just got a new heart. They're sort of worried about, hey, am I doing this correctly? Are we allowed to push? Are you allowed to push me this much? So those are things
Yeah.
that you definitely want to look for and educate them in.
Yeah, and I like when you say during the oncology, we need to brush up our lab values,
Yeah.
and it's really important for us as well. I'm working both in acute care during my PRN days, and then it's really the first thing we're checking as well, the hemoglobin, hematocrit, those things, because we're about to bring them out in the and make them walk, you know.
Yeah.
So those are some of the other than the other stuff, and I like when you said multidisciplinary. Right now, you really need to good a rapport with the nurses, with the
Exactly.
other. And then if they don't like you, oh my God, there will be nurses that a little bit grumpy, and then they're so tired of work from night shift, you know. So that's really important, a rapport. So what is your tip? Let's say there is one new therapist that's still thinking of what niche they want to know. And just like in your position, they are thinking, is it orthopedic, geriatric, neuro, or acute care setting?
That's going to be a tough one because I think that just jumping into like an orthopedic outpatient setting, you're going to be exposed to different cases. Is a wide variety of cases. You definitely learn how to sort of deal with people, and I know how different clinics are. You get all these patients at once. So you sort of learn how to like multitask as well. But I think just try out like a setting. Let's try out outpatient, see if you like it. Um, if that's really your passion, then go for it. But if you more so you like working in a team, like handling these complex cases, you like really getting the people back on their feet, especially when they're like bedbound or just very deconditioned. But yeah, it's just finding your niche, finding what your calling is, and seeing what fits with you. And I think
Yes.
any setting's good for anyone. It all comes down to if you find a good like mentorship, a good team to work with, and that really plays a big factor in your choices. So I think it's just getting to know the team. It really plays a big part and really makes the job so much easier when you have everyone that's buying in into the program and someone that's supportive and very cohesive.
That's true. That's true. And I like when you say the passion because that will follow you. It's like a roadmap. When you know your passion and that you just look for it. So
Mhm.
passion and then mentor and then the place.
Yeah.
And everything will comes into place, you know. And then if you are going to suggest a specific certification or any like educational courses, what do you suggest with us?
I think if you're going more so with like an outpatient sort of setting, the probably one of the top ones they've told me to take are, McKinsey. Um, I think if you're working in sports, blood flow restriction is definitely a good course to do. Um, Probably dry needling is a good adjunct to different sort of therapeutic activities. For acute care, I'm not really sure yet, to be honest. Because I think just getting the experience is more than enough. And then if you have like a passion like cardiovascular or oncology or neuro, you could definitely pursue into like a residency program because our hospital has a residency program for cardiovascular, I think cardiovascular, cardiopulmonary. We have orthopedics as well. I'm not sure about neuro, but if a hospital setting or your setting that you work with has that, that's something I think that you should lean into and pursuing.
Thank you. Yeah. And I know not only you're a physical therapist and doctor of physical therapy, and congratulations, you're graduating. You're already graduating. You're just going
We
to the
finished.
ceremony. You're a doctor of physical therapy from University of Montana. So congratulations with that. And also, thank you for your service of, can you tell us more? What is FACS, the foreign credentialing for physical therapy, and also the review or resources for the NPTE Final Frontier? I think you're part of the leadership or member for that. Can you tell us more, Gabriel?
Yeah. Well, FACS is a nonprofit organization where we sort of help foreign students, with some of their what courses to take or help with processing, the paperwork, like the step by step. We offer like a consultation service. So once you contact us, we look at like your report that you get from FCCPT, and then we sort of discuss, hey, these could be your potential next steps, or these are the subjects for this school that you should take. It sort of takes away like the guessing game. You're asking like, hey, where am I supposed to take this course? Am I supposed to take TOEFL, or what are the requirements for this state? We sort of walk you through that process, and give you, pointers based on your situation. So, and we also have like different free webinars, and we have like a Facebook page and a website as well that we have very easy like tip sheets or general information that you could access. If you need additional help, you could always reach out to us, and then we can go from there.
Wow, that's
Uh,
very helpful
mhm,
because all our therapists in Philippines are really puzzled on the
mhm,
different changes because you'll never know the changes from year 2000 to year 2010 and 2022, you
mhm.
know. So that's very helpful. And then the NPTE Final
Yeah.
Frontier, you're also part of that.
So Final Frontier is a US-based MPT review program that's been
Okay.
founded by Dr. Singh. So I'm just part of one of their license study partners. So we have our main class where I'm sure everyone's familiar, where everyone just joins. You go through like the session, and then we have like readings for you to do. So I think it's probably one of the best structured programs out there. And I'm not just saying that because I use their program. So it's very structured. It tells you what you need to focus on for the exam. It really takes out, again, the guessing game on to what to read. Is this content relevant to the exam or not? So we have everything structured. We provide the readings, and we have a good support system. So if you need additional help, again, we have those licensed study partners. I was one of them, but right now I'm focusing on like my board certification. So I'm not really part of that, but we do have a wide team who are ready to help if we need that additional help. So we also have like a small Facebook group. We also
Mm-hmm.
have a Philippines-based Facebook group for more of like Filipino students or Filipino PTs that can join.
Oh, cool. Yeah. So for the NPT Final Frontier, a
Yeah,
counterpart in Philippines. That's really
a little
important
provision
because,
where you could ask like,
uh-huh,
I graduated this from this school. Who else did
okay.
that? What subjects do I need to take? And stuff like that.
Oh, it's very important a group because you're having question and support group, socialization as well,
Mhm.
lessening the stress. So they need to pay for this. So they need to first approve with the FCCPT before in this transition, they should have papers already, something like that.
Yeah, I mean, you should
Okay.
generally have an idea when you're taking the exam. But
Okay.
the thing about, Final Frontier is obviously it's valid for 1 year. So if you purchase it now, it's valid until next year.
Okay.
Basically 3 cohorts worth. And you could always
Mm-hmm.
pay in like installments, or just pay for an extension.
Okay.
Always like try to accommodate the best we can based on your situation.
And this is online.
Yes, it's online. We have live program, and then we also have a program where it's purely recorded sessions, but they're still
Mm-hmm.
basically the same sessions. You just get all the
Mm-hmm.
recording afterwards, about an hour or so after.
Yes. Yeah, that's how I met because I have always in my Facebook, I always see your name promoting that about that. And I help some of the Filipino PTs as well coming here. I said this is a good resources. So I would like to learn more about that. So because I was in an agency before coming here, and we
Mhm.
have an in-house review.
Yeah.
So yeah, so right now the agency is not providing the in-house, so that's why I want to know more so that I can inform them that these are some of the resources available now
Mhm.
outside too, you know. So that's really good. Thank you so much. So as a physical therapist, we always ask our Thanks God it's Thursday feature, what is your best tip for our clients for improving their balance, decreasing their falls? Like you always do because you know that it's really important. Something like that.
Is it like a tip for like
Yeah,
PT?
exercise. Yeah, I know for our clients, for your patients that you always ask them to do or exercise that will help their improve their balance.
I think it's just a very generic,
Yes.
like
Hmm.
stance type exercise. Um, and then you could sort of add like different surfaces that they could work on, challenge, their proprioception and everything. I think that's probably one of the best like standard things I give to them. Um,
Hmm.
you could do it over like a countertop or something. Considering
Yes.
I work in acute care system, I got to be really creative and try to mix things up given the space I have in their room if they could only stay in their rooms.
Yeah, you're in acute care. So when you arrive there, what is the amazing um technology that you see in University of Texas
Oh,
Southwestern? I was there I think 4 years ago, 20, I was there at one time reviewing for the neuro. There's a neuro course, and we went downstairs on the research lab, and we saw all the different like I forgot. It's like for us when I was in Abu Dhabi, it is a robotic relator.
mhm.
Reambulator we call it, and here in America it's a different but almost like. So what are your different technology that you saw now that you're in acute care, not available in orthopedic?
At least for me, at least I think it's new for me. Those emu slings, I think it's sort of like sling when they get them to walking. I haven't used it yet because I haven't gone into the neuro floor yet, but I've seen those used. Um, and I think just some of the typical lift machines, like the Hoyer lift, I think they have a very specific brand that they use at UT, which I think is pretty cool. Another thing that I noticed at UT, at least for me, because we didn't use that documentation program, it's Epic. I don't know if you're familiar with Epic. I think it's probably one of
Yes,
the ones I've used because you could communicate with them.
yes.
You could reach
Mm-hmm.
the doctor immediately and chat them,
Yes,
um,
the Epic also being used here in Delaware.
which is awesome. Probably one of the best I've used. It's just very long.
Oh.
But also we have these little phone devices, not really a pager. It's like called like a Vocera, and you sort of clip it, and you could just press on it. You say to let's say the nurse for room 10, or you call for like Dr. Jenny, and you could talk to them immediately through there. So if you need
Oh,
something and you're sort of like in stuck somewhere with a patient, you could call someone, hey, I'm here. Can you come here and assist me, or I just need help
uh-huh.
moving.
That's quick, huh? Yeah.
Yeah.
For us, it's like it's still a normal phone. We
Mhm.
just bring it anywhere and then we'll just call. And like a pager that they have a specific number for Gabriel, I'll just put
Mhm.
3012 and I'm talking to Gabriel, just like a phone, but only inside. But yours is looks faster because
Yeah.
you just
Sort
press
of
and
you sort of like because it's called a Vocera, and you say, "Hey, Vocera, call Dr. Jenny," and it just calls you. That's granted, I
yes.
pronounced your name correctly.
It's like Alexa, call
Yeah.
Gabriel. That's quick. That's good. That's good. So congratulations for all these challenges and wins, you know. So saying about the challenges, it's really difficult in this transitioning, not always win. You studied doctorate. That's amazing time that we need and on top of your career. So what are the challenges that you really strive to improve, you know, or you happen to you and you're able to win it as a physical therapist?
I think one of the biggest challenges, obviously, is what I'm facing now, just that transition from orthopedics to acute care, because I got really comfortable in orthopedics, and like I'm seeing these patients, like, hey, I've seen you, seen that case before. You become comfortable, and that's usually like a like sort of hampers your progress a little bit once you become too comfortable with things. And just moving out of that comfort zone, that's when you truly grow as a clinician and as a professional. So just jumping through that and then seeing all these different cases. So every case is obviously going to be different. You may have like the same condition as this patient, but obviously you have different factors, different comorbidities that will sort of affect how your treatment goes. So just having that quick thinking and then growing as a clinician with different clinical decision making, I think just seeing that, getting that experience in, just getting outside my comfort zone, outside my shell a little bit, I think is probably one of the biggest challenges that I'm still obviously trying to overcome, but I'm slowly getting there and slowly getting more confident as the months go by.
Yes, it takes time. And then with the people around you, it just makes it faster and
Mhm.
easier, right? Because you said a better mentor. So congratulations, you are in a very good place. I heard great things in University of Texas Southwestern, and is really amazing. You have also another Mike Bridge is also from I think he's more neuro. He is a Parkinson's disease expert, and he also went there in UT Southwestern. So thank you so much, Gabriel. Thank you for sharing all your experiences, your transitioning. Last closing message, especially for our physical therapists looking forward to work here in America, wanting to know more about their niche. So if you have a message for them, what it will be.
Um, I guess my message, like my sort of closing message for them, is to, in any setting that you go into, come in with an open mind, come in ready to learn, and come in ready to grow. Like you said, you got to act like a sponge, try to absorb as much information as possible, internalize it, and then use what you learn to get your patients better. Um, obviously get your ego out of the door. Try to listen to some of the veteran PTs. Read about a few things, and you know even though there's some information that you don't necessarily agree with, you still want to listen to it and then give your take on it, and then you know just keep learning.
Yes. Yes, keep learning. Learning is endless. That's why
Mhm.
from physical therapy, he did his doctor of physical therapy, he's reviewing his certification for orthopedics and goes on and on. And he's sharing his knowledge in reviews for our future therapists here. So thank you so much, Dr. Gabriel, and we appreciate you. So if we would like to know more about you and would like to connect with you, how can we connect with you? Email
um,
or
you could always message me on Facebook,
yes.
Gabrielle Cordero, or you could join our Final Frontier groups. They're readily available, and just search MPTE Final Frontier or
Mhm.
MPT Final Frontier Philippines. So you can join both of
Mhm.
those groups, and I'm usually posting there or just sharing a few things.
Wonderful. And also in LinkedIn, that's how we
Yeah.
connect, right? Uh-huh. Yeah. So guys, if you have any questions to Dr. Gabriel, asking more questions about transitioning or for the physical therapy and PTE, connect with him, and I connect with him via Facebook and LinkedIn. All right. Thank you so much, Dr. Gabriel, and thank you so much, guys, for listening. It's another Thanks God. It's Thursday. I hope you learned from us. And if you want to learn more for different short webinars, we have in Balance and Fall Support Group. Join us, and also in Physiogen PT and Wellness. Thank you so much, Dr. Gabriel. Have a great day.
You
Thank you
too.
so much, guys.